never scrubbed in with Dr. Elder before. Do you think he'll let me do some suturing? It seems like a pretty straightforward hernia.
Oh, I'm pretty sure he will. Most of his cases go pretty smoothly, and he has been doing this for years.
For years? Is he older?
No idea. I mean, more than 50, less than 80. Who really knows with these guys?
Hey guys, hey Bob, good to see you back on your feet. Certainly missed you at the club this weekend. Didn't have a fourth, so they put one of those new young members in. Good golfer, beat us by 5 strokes. You know, we'd rather golf with you, you know. Guy like you, we're always sure of taking your money.
Yeah, sorry I missed it. I was having trouble with my hip again, so I went to the clinic and had Jim inject it. Feel pretty good now. My joints may be old, but my memory's still good. I don't think you've ever beat me before.
Yeah, okay, whatever you say, Bob. Got a good team here today. Let's do the surgical timeout. This is Mr. Smith. We're going to repair his right inguinal hernia. He's not allergic to anything. Now, he is on a new blood thinner, rivaroxaban. To be honest, I wasn't familiar with it, so I called thrombosis, held it 2 days ago, and they assure me that's going to be fine. Anything else?
What ASA class?
He'd be a 3, please. And you know, those new thrombolytic agents are really a problem because there's just so many of them, so many different characteristics. What we've done in our department is created a list with generic and trade names and indications for offset of action. So if you want, we can send that to you.
Yeah, just email it along. I'll send it out to the other surgeons. That would be much appreciated.
Okay.
This is a really interesting way to repair a hernia. I've never actually seen it before. Only read about it in the books.
Yeah, this is the classic shoulder ice repair. I learned it as a resident and been doing it for years. I really think it stood the test of time.
But Dr. Newhire does this new mesh plug repair. Says it's faster, easier, and better for outcomes for patients.
Yeah, didn't they review the evidence at the last journal club? I thought they said that the mesh plug was the standard of care.
Well, you know, I didn't get to Journal Club, but I did read the articles. Do you guys think the evidence is really that much in favor of the mesh plug?
Well, I'm only a resident, but if you're asking for my opinion, it is a pretty safe procedure, and it does show better outcomes for patients. Most of the other surgeons are doing it this way.
Well, you guys are residents, but sure, your opinion matters. And, you know, if Newhire's doing it, he is the evidence guy, and there must be a good reason for it.
You know, I worked with him last week. He seemed like a pretty good surgeon. The technique was really slick. The patient did really well afterwards. I think he's all right.
Yeah, of course he's a good surgeon. We trained him as a resident, and we made sure he came back to us after his fellowship. You know, you got to keep good talent around when you see it.
So should we do a mesh plug repair for Mr. Smith today? I've done quite a few the past month, and I could show you how.
Oh, that's a kind offer, but I did consent him for a shoulder ice repair, and you know, you should do what you consented the patient for. But I am doing another hernia next, and if we can go change the consent, we can find Dr. Newhire, I'm willing to try the mesh plug.
Excuse me for asking, but are you really going to let a junior staffman and a resident walk you through the next case?
Yeah, why not? I mean, that's the beauty of working in a teaching hospital. You know, you get to learn from you guys, and you learn from your peers. Surgeries changes all the time. What I did as a resident, we never do anymore. I used to do 5 or 10 gallbladders and gastrectomies. Now we don't do them.
You should think about changing your golf swing. Get better at that, too. Maybe you'd have a chance to beat me.
Nah, Bob. Well, guys, I think we did a great job. So what do you think of the old school repair?
Oh, I'm glad I saw it. I mean, I haven't done too many of them, but it's definitely something that I want to learn.
Yeah, it's definitely good to have options. You know, there's more than one way to get things done. So we had a bargain. You kept your end and learned my repair. So if Newhire's around and can look over our shoulder, I'll let you take me through a mesh plug.
Sounds good.
Okay? I'm out of here. Great.
Go around and start closing.
Pick up, please. All right.
Thank you.
I'm excited for the next case. Are you nervous about teaching the staff?
Not at all. I've been teaching them throughout residency. I'm not sure what they're going to do when I graduate.
I'm sure they'll manage.